Yes, men can be affected by breast cancer, and it is important to remember this, that men can be and are affected by breast cancer. Although we know that women are, 20 times more likely, actually more than that in terms of the increased frequency, men are affected, and any lump in a man's breast should also be taken seriously. So if a man notices a lump in his breast, he should take the same precautions and get the same tests done in terms of biopsy of the lump, etc. So men can be affected, and the similar treatment strategies that are employed for women are also employed for men. The treatment of cancers in general can be quite significant. Breast cancer, as we discussed, has different disciplines being employed, and there are different costs that tend to accumulate or may accumulate, but it's good to know that there are different strategies in place, different support groups, support facilities, National Health Fund being one of those, which is able to offset some of the costs. So in terms of the diagnostics, once a woman notices a lump in the breast, a mammogram and a breast ultrasound are usually required, and the Breast Cancer Society is available and does do screening, regular screening mammography for free, as well as the mammogram if a patient notices a lump. So you have that avenue where you can utilize, where it may be free or even at a substantially less cost. In terms of the tissue sampling or the biopsy process, the ancillary tests or the particular tests that are needed to be done, the immunohistochemistry or the receptors to tell you specifically more information on the type of breast cancer. This is also, I'm happy to report, is significantly subsidized by the National Health Fund, and therefore breast cancer is listed as one of the cancers that is covered by the National Health Fund, in part, not totally. So the National Health Fund card, which allows women to swipe at the government institutions. So for example, the drug serves, these are the pharmacies that are subsidized and supported by the government facilities. You can swipe these cards for chemotherapy, where the cost of the drugs are significantly less than if you did not have the National Health Fund, the ancillary tests we mentioned before. It's also important to note that some of these tests are also now available in terms of free at no cost. So for example, the National Public Health Lab has recently started doing immunohistochemistry. So all of their breast biopsies should be getting the immunohistochemical test, the receptors we spoke about, at no charge. So persons within the public institution will be able to access that. Persons within the public institution as well should be able to access chemotherapy at free of cost, providing these drugs are available in the institutions. So the costs, which may be significant, includes your scans, the CT scan of the chest, abdomen, bone scan. Bone scans, unfortunately, are not currently available in any of the public institutions, and therefore this has to be done privately and can vary from about $25,000 to $30,000 for the scan. The CT scans in the private enterprises, CT chest and abdomen, may cost about $60,000. Then the drugs, not all the drugs are going to be provided free of cost. So some of these particular types of breast cancer, for example, the HER2 positive breast cancer, requires a particular drug to be combined with chemotherapy called Herceptin or trastuzumab. And at times, this may require two such of these anti-HER2 drugs, which are quite expensive. So the Herceptin is currently now supported and provided through the NHF in the public institutions. So patients in public facilities are accessing this. Herceptin for a year of therapy, which is usually the standard period of time for adjuvant management or curable stage disease breast cancer, is approximately 5 million Jamaican dollars. So yes, you heard me correctly, 5 million Jamaican dollars for a year of therapy with that single drug Herceptin. So we've come a significant way where the government now covers Herceptin for the 1 year. So every patient with HER2 positive breast cancer can access Herceptin through the public health system once they're managed there. There are some other drugs, however, that are not there yet. We're still working to lobby with the NHF, and they're doing the best that they can. So we are grateful for that for the patients. But yes, it can be an expensive undertaking, but it's good to know that with the subvention and subsidy of the NHF and the government systems, that persons should be able to access their care and their management.